In life, everyone and everything has a role. For example, in hockey, the goalie protects the net, the defensemen help the goalie, and the forwards try to score. If you take away one of them, things get difficult. Without a defenseman, you might not win the game, but if you have no goalie, then you're really in trouble. Just like the different parts of a hockey team, your spinal cord also has areas that have different jobs. And when one of those jobs can't be done, things get really interesting. The spinal cord is mainly made up of 5 parts, called regional nerves, but we'll mostly talk about the 3 most major ones. The nerves highest on your spinal cord are called cervical nerves. Cervical means neck, so these nerves go from the neck to approximately your armpits. The next section down has the thoracic nerves. Thoracic means chest. As you can guess, these nerves go from your chest to your hips. The last one we'll talk about is just below that, called lumbar nerves. This area covers anywhere below the hips. Technically, the spinal cord ends somewhere in the lumbar area, which is why we won't talk too much about the last 2 areas. For those wondering, those areas are called the sacral nerves and the coccygeal nerves. Phew, that's a lot to remember. These areas all have different jobs. The cervical nerves control your breathing, arms, and hands. The nerves in the thoracic area controls your chest and abdominal muscles. Below that, the lumbar nerves are responsible for your legs and feet. The bottom 2 areas control mostly the bladder and bowel, as well as sexual function. How do all of these work together? The spinal cord carries messages to and from the brain. So if your brain wants to tell your legs to move, it sends a message to the lumbar area, where the nerves control the legs. Similarly, if you want to grab something, it sends a message to the cervical area, and so on. When the spinal cord is injured, the messages either get stopped or interrupted at the location of the injury, affecting all the nerves below it. In the next few episodes, we will look at the different nerves of the spinal cord and learn what specific things are impacted after a spinal cord injury. To learn more about spinal cord injuries and other disabilities, don't forget to subscribe.